I'm Jun Lee, a resident from Incheon St. Mary Hospital. My presentation is about changes in the thoracic cavity dimensions of pectus excavatum patients following the NOS procedure. Since 1998, the minimally invasive NOS procedure had become the standard technique for repairing pectus excavatum. However, there was no intuitive method has been described for determining post-operative effect of the NOS procedure in the thoracic dimensions. Harrow index has been used to quantify the severity of pectus excavatum. However, the Harrow index is of limited value because it does not accurately reflect three-dimensional morphological change in the thoracic dimension before and after the NOS procedure. We measured dimension of thoracic cavity before and after NOS procedure using a simple and intuitive method. We retrospectively evaluated CT scan results of 141 patients who had undergone NOS procedure to treat pectus excavatum at Incheon St. Mary Hospital between July 2011 and February 2016. We compared changes in three dimensions among patients of different age and with different types of pectus excavatum and different numbers of inserted bar. The anthropometric dimension measured were the AP and YDT diameter at three anatomical landmarks, the jugular notch and mandibular sternal and Ziphus sternal joint. In our hospital, patients under general anesthetic were placed in the spine position with both arms abducted. The crane technique and wire stitch were used to elevate depression of the sternum. Subcutaneous tunneling was performed through step incision in the skin on either side of the chest, and hinge points were created. After dissecting the retrosternal space using 2 mm needle scope and endo scissors, a 20 French chest tube inserted one incision and passed across the midline and out through the other incision using a pectus clamp. The pectus bar was inserted using a chest tube as a guide and subsequently rotated. The bar was fixed to the lips on both sides with the fixator and the anterior chest wall with number 5 S-bond sutures. The baseline characteristics of patients who underwent the NOS procedure are summarized. Of 141 patients, 87 had symmetric and 54 had asymmetric pectus excavatum. Like this, we measured the thoracic dimension in three anatomical landmarks. This is a preoperative AP and T diameter in jugular notch, and postoperative AP and T diameter in jugular notch, preoperative diameters in mandibular sternal joint, and postoperative diameters in mandibular sternal joint, and preoperative diameter in Ziphus sternal joint, and postoperative diameter in Ziphus sternal joint. This figure means the changes of Harrow index and dimension of thoracic cavity of pectus excavatum patients before and after NOS procedure. Preoperative and postoperative changes in Harrow index. And this means changes of AP diameter in jugular notch, and T diameter change in jugular notch, and AP diameter mandibular sternal joint, and T diameter in mandibular sternal joint, and AP diameter in Ziphus sternal joint, and T diameter change in Ziphus sternal joint. The AP diameter at mandibular sternal and Ziphus sternal joint increased significantly following the NOS procedure, and postoperative Harrow index and T diameter decreased significantly at all three anatomical landmarks. Only AP diameter in jugular notch was not changed significantly. Differences between the preoperative and postoperative Haro index and the AP and T diameter at 3 anatomical landmarks were not statistically significant between two types of pectus excavatum. In multiple bar group, postoperative AP diameter at all 3 points increased significantly compared with preoperative value. Also, postoperative T diameter at all 3 points decreased significantly compared with preoperative value. In patients who were over 13 years of age, postoperative T diameter at all 3 points decreased significantly compared with preoperative value. You can see the overall differences in Haro index correlate negatively with difference in the AP diameter at all 3 points, regardless of preoperative defect type and number of bars. We can demonstrate changes in thoracic dimension following the Nuss procedure using a simple and intuitive method. Anterior depression, which is characteristic of pectus excavatum, was corrected, accompanied by simultaneous compensatory narrowing of the chest after the procedure. Narrowing the chest was particularly evident near the lower sternum and in the multiple bar group and in ages above 13 years. Alternative study will be required to determine the effects of change in thoracic dimension on pulmonary function and thoracic volume. Before this study, we can do just a subjective expectation for compensatory narrowing of T diameter, but after this study, our significant result of narrowing T is meaningful in deriving an objective result rather than an expected interpretation. However, I think to validate this result, we have to find a relationship between our parameter and chest volume. Thank you.
Thank you.